Okay, here we go. So my name is Katiuscia Gray. I'm a licensed clinical social worker. In addition to that, I'm also a certified yoga teacher. I'm an anxiety specialist. I'm a somatic psychotherapist. I'm a trauma therapist. I have my own practice in Lynbrook. So I'm really here today to talk to you guys about anxiety. And I look at anxiety a little bit differently, probably because I'm a somatic therapist. And what that essentially means is that I am a body worker, right? That's where the yoga comes in. Because for me, trauma, anxiety, and mental health issues is not just stored in the mind, but it's also stored in the body as well. And we'll talk about that as our time goes on today in our training. So I think I went too far. Let me go back. Okay, so we're here, just bear with me because it's hard for me to talk and admit I'm a hard person to at the same time, but we're gonna make it do what it do. So we're here to talk about anxiety and the effects of anxiety and how can you notice it when you are seeing your patients in your therapy sessions. So I want to just say this little quote I have about fear. Oh, that's much better. Because a big part of anxiety has a lot to do with fear. And I got this quote, believe it or not, from Will Smith, who I actually think is just brilliant. So fear is not real. It's a product of our imagination. The only place that fear can exist is in our thoughts about the future, causing us to suffer from things that may not even exist. The reason why I like to talk about fear, because fear is such a significant part of anxiety. It's constantly always thinking about things that hasn't even happened yet, which really is the definition of anxiety. So let's talk a little bit about fear, danger, and anxiety, because there are three different types of things that come up. And I want you to sit and kind of observe what are the similarities and what is the differences. So fear is an emotional state. It's caused by the belief that someone or something is dangerous, likely to cause pain or threat. It's a premature emotion, right? It hasn't even happened. So you're worried about something, you're fearful of something that hasn't even happened yet. Danger, the possibility of being in a situation in which loss of life or serious harm is possible. Danger is real. Danger is real. For example, I grew up in the hood, right? So in growing up in the hood, there were certain neighborhoods that you just did not go to because you knew past a certain time, something was going to happen. Some sort of trouble was going to happen. That's danger, and danger is real. Another example of that is driving drunk. That's dangerous. So if you have been drinking a little too much and you decide to get behind the wheel and drive, that's dangerous because you could not only hurt somebody on the road, but you could also hurt yourself. Excuse me. Anxiety. Anxiety is an emotional state of a perceived threat or a possible threat. It's a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain future. So when I explain anxiety to my patients, I always say, you're thinking about things, you're worried about things, you're fearful of things that hasn't even happened yet. It hasn't even happened.
Can I ask a question?
Absolutely.
I had a cousin who got bit by a dog in a young age. So when she became an adult, even in her 40s, she was scared to death of dogs. So is that because you said fear is a premature emotion?
Yes.
So was she fearful of dogs, or did she have an anxiety against dogs?
So it starts with the fear, right? And then if we don't catch it at fear, to make our brain and our body know that, yes, this happened to us a long time ago, but the chance of it happening right now probably won't, it turns into anxiety. It starts at that fear point, like I said. If we don't catch it and start to convince our brain and let our brain know that, okay, this happened to us, this really bad thing happened to us, but the chances of it happening again.
Very good.
Pardon? Oh, sorry, I thought I heard somebody.
So it's actually an anxiety?
It's actually anxiety. It's actually a fear that turned into an anxiety.
Okay, gotcha.
Yeah. Okay. So just a couple of stats about anxiety, very staggering numbers. Anxiety, can you guys just put yourself on mute? Because there's some feedback. Thank you. Okay, so some pretty staggering numbers on anxiety. Anxiety affects 40 million adults in the world. 3 out of every 10 people suffer from anxiety. That's pretty staggering. Since COVID-19, about half of the population, suffer from some form of anxiety. That's pretty staggering. That's a very pretty staggering numbers. So when we think about people in our family, when we think about people that we work with, when we think about our circle, it's every other person that suffers from some form of anxiety.
Many keep it to themselves, right?
Pardon?
Seems like many are keeping it to themselves. I know a lot of men that suffer with anxiety. They don't want to talk about it.
Exactly. I want you to put a pin in that because I'm going to show you the different types of anxiety and how it shows up for different people. So that's a great point you made. Okay, so there's different types of anxiety. Anxiety is not a one size fits all, right? I'm going to talk a little bit about some of the diagnoses of anxiety. And it's important to understand the different types of diagnoses with the anxiety so you know where your patient falls under and how to help them. So generalized anxiety, that's the most common. And it's really characterized by excessive worry that is difficult to control. OCD, another form of anxiety. It's having reoccurring thoughts or ideas or sensations, obsessions, so to say, are due to doing something repeatedly, compulsions. So you think about people that wash their hands. Let's think about this COVID-19 because that has heightened everybody's anxiety. Yes, we were told that we had to wash our hands. Yes, we were told that we had to wear our mask. Yes, we was told that we needed to be careful. But think about some people that were washing their hands morning, noon, and night. They had their sprays. They were with their families, and this is their enclosed bubble, but they still had their mask on. You know, it's interesting, during the heightened of the pandemic, you would see families in their car with the windows closed and everybody had on a mask. And I would be like, I don't understand why y'all all wearing masks. This is your family. But that's part of OCD. It's a recurring thought or an idea that we're going to get sick. Something is going to happen.
I see just one person in the car with their mask on.
Yes. Yes, yes, it is. It is. A panic disorder. A panic disorder is, and you'll often hear people say, I had a panic attack, because panic attacks could get masked as heart attacks because it feels that serious. So a panic attack is a sense of extreme fear or panic. You feel it so strongly in your body, it legitimately feels like a heart attack for people. So oftentimes I used to know a doctor, and he would say 1 out of every 10 patients that would come to the ED complaining of heart pains, heart palpitations, they would think that they're having a heart attack, but it was actually a panic attack. And what you said in reference to men, it's more men that have that as opposed to women. Mm-hmm.
Wow.
Yep. I'll talk a little bit about that in our time together. PTSD. PTSD happens when a person has difficulty recovering after a traumatic event. So this includes unwanted, reoccurrent, distressing memories, nightmares. This has a lot to do with our rape victims. This has a lot to do with children in domestic violence situation, poverty, racial violence, right? It also has a lot to do with a lot of our soldiers coming home. You hear that word PTSD, it's post-traumatic syndrome. You can't recover. Something happened to you and you can't recover. It's in your mind, it's constantly in your body, and you're thinking about it repeatedly and you can't get yourself to calm. Social phobia. A lot of kids and adults have this as well. Social phobia essentially is your fear or you're anxious in social situations. You see kids and adults, I've seen adults who are at a party, for example, and they're on the side. Everybody's laughing, everybody's cracking jokes, and they're on the side and they're staring at their cell phone. That's a social phobia. Why are you on your cell phone when we're at a party? Mix and mingle with us. A lot of our kids are going to have, if they already do, have social phobia. I think the cell phones are great, but it is disconnecting our kids from the world. These kids are at lunch, these kids go to parties, these kids hang out with each other, and all they do is stare at the phone. Nobody is talking. That is a fear that if I say something, they're going to reject me. I get nervous. So think about that when you think about your clients.
So to be fair, we say kids, but
No,
what happens when we go out to restaurants and the couples are just sitting there staring at their phone, no conversation?
yeah, that's social phobia too. Why are we not talking? Why are we not connecting? There's some sort of fear that is holding you back from talking to me. Because
So
why
do
are
you,
we at a restaurant and you're staring at your phone? To me, I think that's incredibly rude.
so do you think that there are some male and some females who are single, good looking, got a lot to give to a relationship, but they suffer from social phobia and they have a hard time meeting people?
100%. And
Okay.
our job as the therapist is to make them aware of that. So it's not that you have just anxiety. What form of anxiety do you fall under? And
Okay.
when you fall under this anxiety diagnosis, your job is to make them aware on how it shows up in their life, just like you said. So I would talk about social phobia and how social phobia shows up for people. And then as you get to know them, you start hearing their story and you start giving them examples of this sounds like a social phobia. You are out with a date, you're out on a date and you're not communicating. You picked up on your phone and you're staring at social media. What was it that prevented you from speaking? And when you unpack that, you're going to hear fear. I was scared. And that's when the work happens. That's when the work happens. Because as I said, anxiety and fear is closely related. It's thinking about things that hasn't even happened. You're worried that he's going to judge you. You're worried that he looked at you and that look was interpreted differently, but that's not real. That's fear. And I'm going to talk more about that. Okay. So when we have anxiety, we have what I call a lot of cognitive distortions. Cognitive distortions is essentially, it distorts information from the environment, right? So these cognitive distortions, they're not real thoughts. They often reinforce these negative thought patterns, and it could increase your anxiety and how you manage stress. So we've diagnosed our patient with anxiety. We've talked about which form of anxiety do they actually have. Now we're making them aware of distortions. There's about 15 distortions, but I only put down the top 5. These are the ones that people relate to. So you can look up on your own all the cognitive distortions, because it's important to provide psychoeducation to your patients about how their anxiety shows up. So 1, catastrophic thinking. Catastrophic thinking is dread or assuming the worst. So my grandmother, who's an old school Haitian Caribbean woman, would constantly be like, you can't go to the store. Somebody is going to kidnap you and rape you. catastrophic thinking. And I remember being 15 and saying, I don't understand, out of all the people that they're going to kidnap little old me at 2 p.m. in the afternoon, and a white van is going to show up. That doesn't make any sense. Catastrophic thinking, thinking the worst is going to happen. It's distorted. Mental filtering. You ignore all the positives and you focus on the negative. So my specialty is children and adolescents and young adults. So I'll see an adolescent who studies, takes the test, got a 97 on the test, and says, but I could have got 100. Wait a minute, what? What are you talking about? This was positive. You studied, you put in the work. This is amazing. You got a 97, but now you're focusing just on the negative. And the negative for you is you didn't get 100. Okay. Magical thinking. This is a big one that you'll find with people who have anxiety. When people assume they know what others are thinking. So I have a daughter who suffers from anxiety. It's gotten a lot better now. I'll give you an example of magical thinking, or mind reading is what we like to call it. She used to be she is an amazing baker. And there was one time she wanted to make banana bread, and it was like 12 o'clock at night. And I was like, you can't make banana bread. It's 12 o'clock at night. Because she was sensitive about her weight and because she had her own anxiety, the first thing she said is, you don't want me to make banana bread because you think I'm fat. I saw that look you gave me. What look? What look? This is my face. What look? This is just my face, right? That is an example of magical thinking, mind reading. You don't know what my face said. You're not a mind reader. Unless you could legitimately go inside my mind and tell me what I was thinking, you're not a mind reader. You'll hear your patients say that a lot. Well, my spouse gave me this look, so I know he was mad at me. How do you know that? How do you know if his stomach wasn't hurting? How do you know if he wasn't thinking about a bill, et cetera, and et cetera? Jumping to conclusions. It's another part of a cognitive distortion. Without someone saying so, we know what they are feeling and why they act the way that they do. An example of that would be, okay, I'm supposed to go out with a friend and we're supposed to go out at 6 o'clock. At about 5 o'clock, I don't feel well. So I call her and say, oh, you know what, Samantha, I don't feel like going anymore. So we'll reschedule it for next time. A person who suffers from anxiety is jumping to the conclusion and saying, she doesn't want to go out with me because she doesn't like me. She doesn't like me. She gave me this look last time. She doesn't like me. That doesn't make any sense. It's distorted. It's not real. Overgeneralizing, excuse me. We come to a general conclusion based on one incident. Right? So you'll hear people like that say, oh, it's always something. Something's going to happen. Oh, see, there it is. He forgot to pick me up from soccer practice. But overgeneralizing. Oh, he never picks me up. He never picks me up. He always picks me up late. Is that actually true? Or is that rooted in your distorted way of thinking? So like I said, it's a cognitive distortion that is an exaggerated pattern of thought. It's not based on facts. Your job as their therapist is to not only make them understand the distortions and which distortion that they fall under, but really talking about, is this real? Is this a fact? I always like to say, what evidence do you have that that is actually true? Or is that your anxiety being triggered? So we just had a question in the chat box. Sorry for being late. I was Reverend. No problem. What's the difference between SAD and social phobia. SAD is something completely different. That is part of depression. It's not a social phobia. I hope that answers your question. How do I take this out? Okay. So I want to spend a little bit more time on anxiety and the brain. This is where I talk about how anxiety is stored in the body. So the part of the brain that fear is stored, it is the fear center of the brain. It's the brain's emotional computer alarm system. It's called the amygdala, and it's placed right here. There's other parts of the brain that is super important, but for time, I'm not going to go into that. If you guys want another training specifically on brain, trauma, anxiety, please feel free to ask Amira, and I will definitely be able to come back and give you a little training. I'm not a neuroscientist, but I've immersed myself in the brain and the body because you really need to incorporate some form of understanding of the brain and how it's controlled to the body. So back to the amygdala. As I said, it's the computer's alarm system. It is constantly surveilling the brain, your surroundings, for danger. Ironically, the amygdala, where anxiety is held, trauma is held there too. Because think about it, trauma is this perpetual state of fear. So is anxiety. So it really goes hand in hand. They're not the same, but it's very parallel. I like to say that they're cousins, right? So let's sit with this just for a second. There's the longest nerve stem in the whole body. It's called the autonomic nervous system, and that is called the vagus nerve. Here's the vagus nerve right here. So it attaches to the brain. Here's the fear center, and it travels down to the whole rest of the body. That is connected to what you see. That is connected to how you speak. That is connected to hearing. That is connected to smells. If your brain is always anxious, the brain is like a computer. If you open up the brain, this is connected to this is connected to this, it makes us move, it makes us talk, it makes us do all of these different things. The brain, oftentimes, like a computer, it goes on a brain glitch, right? Can you just lower your volume when you come in? Thank you. So, as I was saying, the brain is like a computer. And much like a computer, the brain catches a virus. And when the brain catches a virus, such as trauma, such as anxiety, it goes on a glitch. So it's making you believe things that is actually, excuse me, not real, not fearful, when it's making you believe that when it's actually not really real. So as you can see, it's connected to the sight. So you take a look at something and you're perceiving it as dangerous. Then your eye starts reacting to it. You hear something, you're perceiving it as dangerous. You're hearing, your nose smells something, it's perceiving it as dangerous. Your mouth is perceiving it as dangerous because it's connected to all parts of the body. So it sends the amygdala, it sends that signal to the autonomic nervous system, which activates what we call the sympathetic nervous system. And the sympathetic nervous system really drives what we call that fight, flight, or freeze. How are we doing so far? I talked about a lot. Any questions? This is a lot to unpack. I think I had a question. Lord, how do I check the questions? Oh, here it is. Oh, just thank you. You're welcome. Okay. Okay. All right, so we're good so far, yes? You could just give me a little thumbs up if I'm going too fast, if it's...
You're good.
Excellent.
You're good.
Excellent, excellent, excellent. Okay, so let's talk about that fight, flight, or freeze response, right? Remember what I said, the sympathetic nervous system gets activated. Your body goes into what we call this fight, flight, or freeze response, right? So the fight, flight, or freeze, it's immobilizing, right? It is the part of the body that we can't control because this is innate in us. So going back to what I said about that fear center of the brain and your brain going on that brain glitch, and it's interpreting all things as dangerous when we're just sitting in this room. So let's say we're sitting in this room and I smell something, and that smell brings me back to my trauma. That smell brings me back to my anxiety, right? All of a sudden, there's the alarm. Remember what I said about the amygdala? It's the computer alarm. The alarm starts ringing. So your brain literally is like, uh-oh, danger, 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 danger. When in actuality, we're not in danger. We're in a glitch. We're just in this room. So what happens is it activates that alarm system. It activates the fight, flight, or freeze response. And then what happens is cortisone gets released out of the body. Once that cortisone gets released out of the body, your breathing changes. You start breathing heavily. Your heart starts racing really, really fast. Maybe your stomach starts hurting. You start shaking. You're activating. This is what the body does. It's activating to fight. Oh my God, somebody's coming for me. Somebody's coming for me. I got to put up my dukes. I got to fight. I got to defend myself. Or flight. Oh my God, somebody's coming for me. I got to defend myself. I can't stay here. I'm out of here. Pew! Or, oh my God, somebody's coming for me. Somebody's coming for me. I don't know what to do. I'm immobilized. I'm completely still. I cannot talk. I cannot move. I cannot do anything. And why is this important to know? Because it is important to know where your patient falls under. Psychoeducation is one of the most important things that we can do for our patient. We gotta let them know where they fall under so they could start making changes for themselves. And fight, flight, or freeze often always just doesn't look like I wanna fight or I freeze. It could also look like immobilization. I'm completely out of it. And you see those people who are very depressed or who are so anxious, they don't know what to say, so they're completely still. They don't move, they're immobilized. Sometimes anxiety is often masked as other things. Anxiety is not a one size fits all. So you see people sometimes who are very angry. You know those people, they go to 100 super quickly. But when you unpack that as their therapist, it's really because they're nervous, they're anxious, they can't control their emotions or their feelings. So therefore, they go to 100 and it comes across as aggression. It comes across that I'm going to fight you all the time. That is all part of anxiety. How are we doing so far? Any questions? Okay, no questions. So I want to show you a little video on the freeze response.
Yeah, I was about to ask a question about that.
Okay. So I'm going to show you a video and then you can let me know. So this is when we talk about the freeze response, we're talking about, if you ever seen a possum, possums play dead. They literally play dead as a survival mechanism. So I'm going to show you this really quick video. Make this bigger. Okay.
This tactic is of little use, especially since the opossum can't run fast enough to hide very far away. just as the second coyote senses that a meal is at hand. Her mate appears to have lost his appetite. Most predators need the stimulation of resistance to incite them to kill, and the act of killing to induce them to eat. An inert body inspires little interest. But the possum is still breathing, and in fact, it's only playing dead, playing possum.
But
Time
you
and
didn't have to watch the
danger is past.
discussions after the just
Not just consciously putting on a good act, however, it actually goes into a state similar to shock, a condition known as anatosis.
I'm sorry. Can you guys put your stuff on mute, please? Because it's coming off in the feed. Thank you.
Coyotes are fooled into searching for livelier prey. While gradually, as it senses that the coast is clear, the opossum comes out of its trance and goes about its steady, deliberate way.
Okay.
This tactic is of little use, especially since the opossum can't run fast enough to hide very far away.
So that worked because the coyote didn't want to eat it.
Exactly.
If the coyote started eating it, it would have been a wrap.
Exactly. So it's something that it's innate. So remember what I said earlier, you become so immobilized, you're so fearful, you're so afraid that cortisone gets released out of the body and it activates that flight, or freeze. And the freeze is, I can't move. I'm completely immobilized. I can't move. And you hear these stories a lot with rape victims who say, I don't remember what happened. I don't remember. I know that someone attacked me, but eventually after a while, your brain freezes and you cannot get out of that state because it is so traumatic for you. And that is what anxiety feels like to people as well. It's so traumatic. That fear is so real for them that they cannot move. And the reason why the fight, flight, or freeze is important, not necessarily just for trauma, is, as I said, it is one of the most important things to provide psychoeducation to our patients. I have multiple sessions on the fight, flight, or freeze. I have multiple sessions on cognitive distortions and how it shows up for people. It's part of your therapeutic work and part of your therapeutic process. Does anybody have questions about that or want to put it in the chat box?
It's kind of crazy how the three are different. But you get in a situation where you feel, okay, I got to fight. You get in a situation, I'm out of here. There's no way I'm staying. But then the freeze part, I don't know how, I have a tough time seeing that as a anxiety when you just freeze. I'll probably get it later.
Okay, just I can answer it really quickly. Tell me why. Why do you think that it's so hard to freeze and it not being anxiety?
Part of me gets that part.
Okay.
Because it just seems like these are also related to, they could mean life or death in some situations.
True.
So the fighting part, sometimes you might not be a wise decision to fight.
Right.
Flight, sometimes you need to run away. They say if you could dodge, you run side to side, it's hard for somebody to shoot you.
Right.
You stay in that situation, most likely you will be shot.
Right.
But the freeze is kind of saying, oh my God, am I giving myself a chance to survive? I mean, that's just what I think.
I hear you. But what I want you to start thinking about how it immobilizes them. They can't move. Remember, this is all about the fear. the
Right.
fear center of the brain that tells them, I can't move. I don't know what to do. And the reason why it's important to understand this for anxiety, because some of our patients are so anxious, and I've seen this in my sessions, they'll stare at you and blink. And you'll be like, are you okay? They're in a freeze response. When I see children and I'm talking to the parents and the parent is saying, I just asked her to clean my room, to clean her room. And then I started yelling at her because she wasn't paying attention and she just stared at me. Yeah, because she was in a freeze response. Does that make better sense?
Definitely.
Okay.
If I could add something,
Please.
Yeah. I think the challenge around freeze response is the whole I don't know what to do. Right? Because if our response is to fight,
yeah,
we have identified some solution, right? And if our response is to flee, we've identified a solution. So I think the reason that people freeze, as you said, you know, is like, I don't know what to do. Like, I don't know the solution to this problem that I'm in. So I'm stuck.
Yes. Yes. And I want you to go back also to, it's not that I don't know the solution. It's that I'm so scared. I'm so frightened. I have been triggered so much. I can't do anything. My brain literally will not allow me to do anything. It's not being done on purpose. It's just where I am.
I want to respond to what Zoe said, because I know exactly the feeling.
Yeah, can you tell me your name?
Robin.
Robin.
I have that response when I run across a big rat. I mean, I'm terrified. I am terrified of rats. And when I come across one, I know I'm not fighting. And I'm afraid to run.
You can't fight a rat. You can't fight a rat.
Right. And I'm afraid to run because I'm afraid they're going to chase me. So you literally freeze because you literally don't know. Your body is so inundated with such fright that you can't make a decision about running or you just you stand still. I mean, it's just an automatic response I have when I see a big rat, you know what I mean? So it happens, you know, that freeze.
Yeah, you said that beautifully. That's exactly what happens.
That's good that she brought up the rat, because when a rat gets cornered, what does it do? It fights for its life.
Yep.
That's their instinct, natural instinct.
Yep.
Right.
I had another question. Let me just go in the chat box. Yes, I am. Okay.
Wait, I have a question. My name is Nicolette. Could you also say like freeze is the same as like a client feeling numb, like they don't know what to do, they don't know how to feel, they don't know where to go, so they're just like, I just feel numb in this situation.
That's exactly what it is. Remember what I said just a little while ago, it's immobilization. And immobilization is a form of disconnection. Disconnection has a lot to do with disassociating. You see that possum? That possum froze because it disassociated from its body. That's exactly what it is. So it's important for you to understand that so you could explain that to your patient. So thank you for that. Does that answer your question?
Yes, thank you.
Yes, anytime. So what can we do? I want to talk a little bit about strategies and interventions. I know lots of people do a bunch of different strategies and interventions in scoring. They do the PHQ-9. Me personally, I like to do the DOS-21 score. Has anyone done that before? I could pull one up to show you.
No, I haven't heard of that one.
Okay, so I'll pull one up to show you guys. One second. Oops.
Is it free or do you have to pay for it?
No, you can get it on. I'll send a copy to Amira and she'll send you one.
Thank you.
So it looks like this. It's a little sideways, so I'm not that computer savvy. So it looks like this.
We don't see it. I don't see it anyway.
Oh, you don't see it? Okay, what happened?
Strategy interventions?
We still see the slide.
All right, hold on. Let's see if I could take this down. Take this. And this. Do you see it now or no?
No.
Oh, no. All right, hold on. So I'm going to stop share. Share. Here it is. What about now?
Yep.
Okay, perfect. So it looks like this. And the reason why I like the DOS-21 scale is because it captures stress, anxiety, and depression. And when you really unpack your patients, anxiety, it starts with stress in actuality, because if your stress is really, really high and we don't catch it, it goes into anxiety. If we don't catch it at anxiety, and it's not that we don't catch it as well, anxiety and depression goes hand in hand, because anxiety is always thinking about things that hasn't even happened yet. Your body and your mind can't stay here because, as I said, you're always 10 steps ahead. Your depression kicks in because depression is always thinking about stuff from the past, traumatic things, hurtful things, things that has happened in the past. And it often flip-flops, right? It goes into anxiety, depression, and it just keeps going back and forth. And it makes people like, oh, they can't be present because they're always thinking about the future and they're always thinking about the past. When we do other sort of scales, it gives you a one-sided thing. So it normally gives you just depression. It normally gives you just anxiety. This captures all three. So it's important to provide your patient with that psychoeducation. And I'll send a copy to Amira.
Thank you. I appreciate that.
Anytime. Any questions about that scale?
Is that something that we complete or we have our clients complete?
I actually give that to them for homework. So I give them that for homework after my second session with them, because by then I would be able to have a better idea of, based on my psychosocial assessment that I've done in 2 sessions or maybe 1 session, I've come to a somewhat conclusion, like they look like they have depression. They look like they have a little bit of anxiety. I don't really know. So I explain the scoring system, and it's important to explain things in a way where they can understand it. So I'll tell you how I say it. I say, so I've seen you for the last 2 or 3 times. It kind of looks like you have a little anxiety. It kind of looks like you have a little depression, but I'm not quite sure yet. So I'm going to give you your first piece of homework. I give tons of homework in my therapy sessions. I just think homework is a very important part of the therapeutic process. And then I go, this is a scaling system that essentially tells me if there is anxiety, if there is depression, and how high it actually is. And I say, it's like going to the doctor, right? You've had a stomach ache for such a long time, right? And you finally go to the doctor and you say, my goodness, my stomach has been hurting for 6 months. And the doctor says, of course your stomach's hurting. You got an ulcer. Here is the medication to help you. That's how I view mental health therapy. We are the medicine to help them. So when they bring it back for homework, we score it in session, and I tell them, remember, this is to give you a better understanding of what's going on with you. And I'll break down, based on this, your anxiety is extremely high. Your depression is extremely high. Your stress is extremely high. And the reason why we give them that psychoeducation, because people know something's been going on with them for a long time. Now we are giving them language into what they feel. It's not that you're crazy. It's not that things are all over the place. You're anxious. You're depressed. And now that we know what this is, now we're going to cater your treatment and cater your sessions around, where did this come from and how can I help you? Does that make sense?
Yes, thank you.
Anytime. Another activity that I like to do is a thoughts on paper exercise. Remember what I said about anxiety earlier. Anxiety is cognitive distortions. It's fear-based. It's things that hasn't even happened yet. It's irrational. Most people are visual learners, including myself. Thoughts on paper is an amazing exercise because you get to spend a session and you take out pieces of paper and you literally say to them, we have been talking so much about anxiety. We have been talking so much about depression. We've talked about distortions. Now I want to start to think about these thoughts that are always looming in your mind. What I want you to do now is take all those thoughts and I want you to put it on each paper. The ruminating thoughts, the aggressive thought, the anxious thoughts, the depressive thoughts, the stress thought, every single thought that consumes you, I want you to put it out on this paper, one thought per paper. And I have them write that out. I have them spend at least 10 to 15 minutes of doing that. You could even do that online. After they write it all out, I place the thoughts literally out and we step back and we look at the thoughts. It's one thing to have these thoughts in your mind repeatedly, but it's another thing to actually see it out on paper. That could be very fearful. That could be very vulnerable. People who suffer from anxiety have a hard time being vulnerable. People who suffer from anxiety have a hard time admitting they have anxiety. So now that we see all these anxious thoughts, what does it feel like? How does it make you feel? And hold them accountable to, I don't know. Yes, you do know. Let's talk about a feeling word. If you're feeling how to word, tell me the word it would actually be. Oh, this feels sad, sad. And that's how you process more and more. Then based on the thoughts on paper, I have them label the thoughts from one, the highest thought, which is one, all the way down to the least thought. And then I processes that with them. I sit and I tell them what I notice about their thoughts. Have them give back to you, what do they notice about your thoughts? You will often hear people say, well, it's fear-based. I see a lot of fear. Yeah. And a lot of it can be irrational, right? So I've had kids and adults who say to me, I'm constantly worrying about my children, right? I'm constantly worrying that my mom is going to pass away. She might pass away. Everybody's going to pass away. But will she pass away right now? Is she healthy? Yes. Is she strong? Yes. Does she eat healthy? Yes. Does she exercise? Yes. Does she have any ailments? No. So if all of those things that you said are true, what is really the possibility that she would pass away right now? So you're missing spending time with her and enjoying her because of this looming fear of she's going to die. That's your anxiety. Does that make sense?
Yeah.
Okay. Any questions about that?
Thank you for sharing.
Yes, anytime. Another exercise that I like to do is grounding, right? You don't have to be a body worker like me or a yogi to give people grounding. Grounding exercises reorientates people back to the present moment. Remember, when we are triggered because our amygdala gets stimulated and triggered, we're constantly on the move and we're on that fight, flight, or freeze. So we can't stay still. We're all over the place. So our job is to bring them back, reorient them back to the present moment. And how do we do that? We do that by giving them grounding strategies. What are the grounding strategies that I like is finding your happy place. And I actually have them draw this. I have adults do this too, because I have adults that I see and I do play therapy with them. I'm a play therapist. So I have them do play therapy. And I say, if you can think about your life, let's scan your life and let's think about the best moment in your life that was so happy for you, that was the best time in your life. Maybe that was a vacation. Maybe that was something in your life that you think about and it just makes you so happy, right? And so I have them either draw it out, write it out, journaling out, talk about it in session, and we spend some time talking about why is this your happy place? And then once we figure out why is this their happy place, I actually incorporate what's called the 5 senses. And the 5 senses is, what do you hear in this happy place? What do you see in this happy place? What does this happy place feel like? I'm missing senses. Sight, help me out. Sight, touch, smell. Sight, touch, smell. What else are we missing?
Feel.
Taste.
Sight, touch. What's the other one?
Taste.
Pardon?
Here.
Hear.
Taste.
I think it's just smell. We don't, hear, see, feel, and smell, right? No?
Yeah, so sight, touch, smell, hear, and taste. Excellent, I got it. So back to the happy place. So we start making them visualize this happy place, right? What does the happy place smell like, right? What does the happy place feel like? What do you visually see in this happy place? If it had a taste, what would it taste like? If you touched it, what did it feel like? And sometimes I do like a little meditation with them. Once again, you don't have to be a yogi, you don't have to be a meditator to just sit with them and unpack and connect the happy place. Let's spend a little bit more time. So for me, my happy place was my grandmother's house. And I would say my grandmother used to make coffee and the whole house would smell like coffee and it would smell like essence. And she had this beautiful smell. She had this beautiful smile. And I felt so calm here. I felt so happy here. So whenever they're getting ready to be triggered into the fight, flight, or freeze, bring them back and orient them back to their happy place and their 5 senses. And so that is it for me for today. If you guys want a little bit more information about the brain or more trainings, please feel free to let Amira know. I'm Katiuscia Gray. The name of my practice is called Mind Meets Movement Counseling Services. You can find me on Instagram and everywhere else. I'm gonna stop share because we have like 4 minutes and I can answer any questions that anybody has.
What's the name of your Instagram?
Mind Movement HS.
H what?
HS. I'll put it in the chat box.
Mind Movement HS.
Uh-huh. Where's the chat? HS. All right. Any questions? Anything I can answer? So Amira already sent you the notes to this. She should have sent it yesterday. Y'all didn't get it? She did. She sent you the slides.
I think she did.
Okay.
Thank you. I didn't check that email.
Okay. The only thing that I didn't include was the DOS 21. I'll email that to her.
All right, thanks.
You're welcome. Oh, oops, I put direct message. I'm supposed to put.
I'm on Instagram now. Say it one more time.
Yeah, I'm gonna put it in the chat.
Okay.
Mind Movement. HS.
HS.
Yeah.
Gotcha.
Yes. Does that make sense to everyone, how it's important to sort of incorporate some sort of brain psychoeducation to make people understand a little bit more about anxiety, to make people understand a little bit more about mental health and how it is not just stored in their mind and their body? Does that make sense?
Definitely.
does a lot.
Awesome.
Yeah, I learned a lot. I definitely.
Awesome.
Hi, I have a question.
Absolutely.
My name is Ernesto. How can you tell the difference between like when someone is having like a panic attack and someone's anxiety levels are high? Is there like a difference, something that you could pick up, like, I don't know, in terms of like behavior wise or what they say or something?
So the question was, what's the difference between an anxiety attack or a panic attack?
Right.
So it's really essentially the same, but panic, remember what I said, it's that overwhelming feeling where you can't catch your breath. Your heart is racing super fast. Your stomach is hurting really, really hard. You start to feel it somatically, and somatically is in the body. So your job is to kind of figure out if this is anxiety or is it, now it always is anxiety, but we just don't know what kind of form of anxiety it is. If it's a panic attack, and if it's having in session, then we need to try to catch it before it gets into a panic by doing some of these grounding strategies. If they can't catch it, then we may need to call 911 because it legitimately feels like a heart attack.
Okay, thank you.
You're welcome.
Will this technique of 5 senses always work, or?
It always has for me.
Yeah.
Now, what sometimes people have difficulty with is sometimes they can't find a happy place. So if they can't find a happy place, make something up. Some of our patients has gone through tremendous amount of trauma. So maybe we could create a happy place. Let's visualize, what is a happy place for you? Is it the beach? Is it the pool? Is it a barbecue? Is it nature? What is a happy place for you? And then create the happy place around that.
That's true. I use that to my clients sometimes. If they keep saying that I don't know, so I tell them to like use your imagination and let's go to this place.
Yep, that's good stuff. I do that as well.
Thank you.
No problem, Torianne. Any other questions? Yes.
Also, a technique that I have kind of like suggested to people to try is to kind of like go through the alphabet order and to each letter, say like a vegetable, a fruit, something like that. And the chances are that, you know, maybe into like 5 letters or something like that, they would, you know, kind of like finally forgotten about whatever it was that was making them feel anxious at that moment.
Absolutely. I just want you to be mindful that we don't want them to forget, because forgetting what they're feeling, the whole purpose of it is to make them feel what they're feeling. And part of the senses and the interventions is to reorient them back to the present. So forgetting means that it's just busy work. And busy work is not important, because when you stop being busy, that feeling is still there. So we want to make them come back to present while feeling that discomfort. So when they know that that feeling is there, I could start saying to myself, it's not real, it's anxiety. So what can I do to get and bring my anxiety under control? Like you said, the letters A. Let me scan the room to look for something that starts with an A. Let me scan the room that starts with something to B. So they're not ignoring it, they're trying to bring it under control.
You're also exercising the senses.
Yep, exactly. Exactly. All right, guys. Well, thank you for having me.
Thank you so much.
Anytime.
Anytime.
It was lovely meeting
you.
everybody. And you guys will get this recording. And Torianne, I'll make sure that you get the slides. I'll tell Amira that.
Thank
All
you.
right, bye everybody.
Bye. Have a great day.
Bye.
Great weekend.
You as well. Oh, not stop recording. Stop.